Hi everyone. Indeed, I'm Julia Mikolai from the University of St. Andrews, where I'm a senior research fellow. And today I'm going to talk about this piece of work that is still very much in progress, that is looking at the COVID crisis and children's mental health in the UK. And we aim to compare couple parent and single mother families. Like Kat's paper, this is a joint effort between the ICWBN management team. So we probably all noticed there's been a lot of media attention on children and their well-being and mental health in the UK and also in other European countries. And these reports have highlighted how children are faring due to school closures, lockdowns, and also limited contact with their peers, family, and friends. So research has also followed through and studied children's well-being and mental health. Although these pandemic-related factors really indeed directly influence children, actually their family environment and their parents' experiences is also very likely to be an important aspect. But this has actually received much less attention, both in the media and also in research so far. So really, family is the most immediate environment for children, and this has especially been the case during the pandemic, when most people, and including children, only had contact with the people that they live in the same household with. And so previous studies haven't looked at how the family environment and potential changes in this environment during the pandemic have influenced children's well-being. So with this study, we aim to fill this gap. We study whether and how children's mental health changed during the pandemic, and compare the mental health of children who live in single mother and couple parent families. Finally, we aim to understand whether and how children's families and their social and economic circumstances influence children's mental health in couple parent and single mother families. We know that even before the pandemic, living with a single parent was associated with poorer child mental health. When we compare children who live in single parent families to those who live with both parents, they have worse mental health and access to fewer economic resources. During the pandemic, research shows that all mothers' mental health deteriorated, but single mothers were especially hardly hit during this time. And this might be because school closures will have made it particularly hard for single mothers to combine work and family responsibilities. They were also more likely to have suffered from greater social isolation, and early evidence suggested that single mothers were most likely to be facing financial stress, and their employment has been the slowest to recover. So studies so far have focused either on describing changes in children's mental health overall, or on how school closures have influenced children's mental health and well-being. But we don't really know how families' social and economic circumstances, or indeed potential changes in these circumstances, have influenced children's mental health, and whether children in different types of families were affected differently. Furthermore, much of the evidence is from the earliest period of the pandemic, and we do not yet know if there are any long-term implications of the pandemic for children's well-being. And finally, many studies do not use large-scale or longitudinal data and are therefore not really able to identify accurately pandemic-related effects. So to fill these gaps in the literature, we use data from the Understanding Society study, which has two parts. There is the normal, usual data collection, where the same households are followed up every year, and they are asked a host of questions, one of which is measures for child well-being, which is available in every wave. But these questions are only asked from the parents of 5 or 8-year-old children. And then in April 2020, the Understanding Society team started to also collect data on COVID-related issues. And these data were collected every month to start with, and then every few months later on. In these data sets, parents of all 5 to 11-year-old children report on their well-being. But unfortunately, these measures are not available in every COVID wave. They are only available for July, September 2020 and March 2021. So just to clarify again what I've said, so we basically have these, the normal, usual Understanding Society waves, and then we have the COVID waves. that were in April, May, June, July, September, November of 2020, and then January and March 2021. We selected the sample in such a way that we take children for whom we have a pre-COVID SDQ score, and we have taken this from the last 3 waves. So any child who has a SDQ score from wave 8, 9, or 10, and who has at least one measurement during one of the COVID waves. So in this way, we end up with 1,253 children, almost 50% of whom are observed all 4 times, 28% are observed 3 times, and 25% of them are observed twice. And then you can also here see the timeline of the COVID-related lockdowns and school closures and openings, and how these compare to the waves that we use data from. So for example, you can see that the July wave is already way after the first lockdown and after the reopening of the schools. Similarly, the September wave, because the second lockdown came after in October. And also the last wave of data comes from after schools were reopening after the third lockdown. I think this will be important for some of the results. So I've already alluded to the outcome variable being SDQ scores. So we use information from the Strengths and Difficulties questionnaire, which I'm sure is very well known to many of you. But just to quickly say that this questionnaire contains 25 statements on 5 different dimensions, 5 per dimension. And then parents are asked to score to what extent these statements are true for their child's behavior. If a given statement is not true, that gives them a score of 0 points. If it's somewhat true, that's 1 point. And if it's certainly true, then it's 2 points. And then to calculate the total SDQ scores, these points are added up across 4 domains. And these are the domains of conduct problems, emotional symptoms, hyperactivity, and peer relationships. So basically on the outcome variable, higher scores indicate worse mental health. And just a little footnote that I'm carelessly using this expression here to equate mental health with SDQ scores. I'm aware that this might not be the best way of describing this measurement, but just for the time being and for the sake of being able to be more quick, I think we can say that the SDQ scores are some sort of an indicator for mental health. So we will show some descriptive results and then results of OLS regression. Because we have 4 or at least 2 measurement points for each child, we cluster the standard errors on child ID. And I will show you results from stepwise models. And this is because we wanted to understand how different factors influence differences between children of lone mothers and couple parents. So in the first model, we just have our variable of interest, whether the mother is a lone mother or not. And then we control for the age and sex of the child, as well as the different time points that we have in the analysis. Then in the second model, we add variables that didn't change much during the COVID pandemic. These are mother's employment, the number of siblings that children have, area type. This is actually the different countries of the UK, mother's age and mother's education. And then in the final step, we add variables that will have changed during the COVID pandemic. This is whether children were offered and attended school, mother's mental health, whether the mother worked positive hours, and equivalized household income. You might not find all of these variables on all of the figures that I will show later, because they looked a bit too crammed, and whatever I've excluded, there were no significant results there, but they are all in the models. Okay, so the first question was, how did children's mental health change during the pandemic? And here I am plotting the mean of the total SDQ scores over the 4 time points, and I've just put the times here as a reminder. And we can see that there isn't an obvious unidirectional trend. First, child mental health got worse compared to the pre-pandemic times following the first lockdown, but then it bounced back, and then it got a little bit worse again after the second lockdown. So this pattern is in line with what others have shown, for example, in the CoSpace project, which we will hear about probably in the following presentations. And it's important to mention that these differences are not actually significant. And I think this might be related to the fact that we're catching these children exactly at the time points when their mental health was already probably bouncing back after a lockdown. If you remember the timeline that I showed you of the lockdowns and the data collection. Were there differences between children in single mother and couple parent families? This is still descriptive results. And here I'm showing the mean, still the mean of the total SDQ scores, but then on the left-hand side, this is shown how it's changed over time for single mother, children in single mother families, and then for children in couple parent families. So firstly, we can see that already before the pandemic, there were quite large differences between children of single mothers and those who live with both parents. So children of single mothers had worse mental health than those who live with both parents, and this got progressively worse during the pandemic. But for children who live with both parents, their well-being remained actually quite stable during the pandemic, although there was a little decline in September. How did families' social and economic circumstances influence child mental health in different types of families? So now we're moving on to the multivariate results. And maybe you remember that in the first step, we just put the most basic indicators of the time periods, the child's age and child sex, and to see that whether we still see these differences between lone mother and couple parent families. And indeed, we find a significant difference between children who live with a single mother and those who live in couple parent families. So children of single mothers have significantly higher SDQ scores, that is worse mental health, than children in couple parent families. We also find that female children have lower SDQ scores, i.e. fewer mental health issues than male children. When we add a host of variables that didn't change during the pandemic, we still find a significant effect of family structure. And it's still the case that children in single mother families have worse mental health than those in couple parent families. We also still see the same significant gender differences. And what also shows up in this model is that children of unemployed mothers have worse mental health than children of employed mothers. When in the last model we add variables that also changed during the COVID pandemic, we don't find these significant differences anymore by mother's employment status. But we still find significant differences between children of lone mothers and couple parents. We also still find significant gender differences. And most importantly, what also shows up in this last step is that mother's mental health is a significant predictor of child mental health. Also in this data set, as is also known from previous research. So mothers who have more mental health issues themselves, their children are also more likely to have mental health issues. So to briefly summarize the key findings from this study so far, children of single mothers have more emotional and behavioral difficulties than children in couple parent families. Female children have lower SDQ scores than male children, and mother's mental health is a strong and significant predictor of child well-being. Worse maternal mental health is associated with worse mental health outcomes for children. As I mentioned, this is still very much in progress, this research, and we have very many unexplored and unanswered questions at the moment. So I just wanted to throw out there what we're thinking to do next, and perhaps I can get your feedback or any additional ideas on this. So we would like to explore also different dimensions of SDQ scores, not only the total scores. But perhaps the most important step we would like to take is to estimate mediation models to understand the mechanisms behind this strong and significant impact of maternal mental health and potentially other variables on child SDQ, and to better understand differences between children of single mothers and couple parents. We might actually end up doing some different modeling techniques to better be able to tease out specifically pandemic-related effects. And we also still have to figure out how to use, whether we can use child-level longitudinal weights to make sure that our results are not biased by potential attrition in the COVID waves. These are the references, and thank you very much for your attention. And I really look forward to your questions, comments, and feedback and suggestions. Thank you.